The topic of this research proposal is iron therapy. My question is, can trauma-informed weightlifting support the management of trauma responses in women identifying persons diagnosed with bipolar type 2? The hypotheses of this study are that individuals will find it easier to manage their symptoms in addition to anaerobic weight training. The second hypothesis of this research study is that their weightlifting would make the symptoms worse. There's a heavy amount of research on the benefits of aerobic training on not only physical health, but mental health. You might be familiar with the phrase, going on my silly little mental health walk. There is a lack of research regarding anaerobic training and its risks and benefits on health. Anaerobic training offers a lot of benefits, such as decreased risk of osteoporosis later in life. It's also been proven to be a wonderful outlet for big feelings such as anger, sadness, and even joy. So what is bipolar type 2? Bipolar is a complex mood condition recorded at affecting roughly 2.8% of the US population as of 2007. The causes of bipolar type 2 are not well known. Genetic component is likely, but trauma, specifically childhood trauma, has been shown to increase the rate of onset and exacerbate the symptoms. Some studies have discovered bipolar depression lessened in the presence of exercise. Weightlifting specifically has been shown to facilitate embodiment. However, that's only in trauma-informed settings. So there is a relationship between weightlifting and mental health. My focus is whether or not that benefits will translate into the management of bipolar type 2 symptoms or trauma responses in women identifying folks diagnosed with bipolar. So participants will include women identifying folks aged between 25 and 35, diagnosed with and in current treatment for bipolar type 2. Their treatment should be overseen by a licensed clinical social worker. The brief psychiatric rating scale will be used over a 6-month period to evaluate the participant's symptoms. The BPRS aims to measure symptomology based on 16 constructs. So some of those constructs are emotional disorganization, feelings of guilt, and tension. So the sample size is going to be 10 participants, 5 in an experimental group and 5 in a control group. Experimental group will receive their regular treatment for bipolar type 2 in addition to participating in an anaerobic movement program overseen by a certified strength and conditioning coach 3 days a week for 6 months. Control group will continue receiving their normal treatment for bipolar type 2 overseen by their licensed clinical social worker. They will not participate in the anaerobic movement program.